this session and all of them should be dedicated to Rifah Shlema with your Rabbi Yaron Reuven Shlita. His name is Yaron Ben Doris. Also to Imim Arasi Rachel Bas Brindel, Ariel Ora Bas Anna, David Shlomo Ben Sandra. Also a quick release of Moshe Shmuel Ben Pnina, and BeEzrat HaShem Tzlacha Rabba to Giveras Chana Bas Avraham Avinu and the whole family. So today we continue with our book Shabbos Home, and we're in chapter 27, and now the topic is scraping. So we're on the section of I guess practical application. So we're talking about soaps, right, with deodorants, right, oil, chapstick, lipsticks, ear plaques, shoe polish, all of these beautiful things, baby oil, right. And next topic is, okay, so we left off here. Why? Because it's a long topic, but very important topic, right? We should know of these things, but we must know, but we must learn. So what is it? Use a cream and ointment by someone who is ill. So right, so it's always a situation in a family, or with one some, not always, but comes from time to time. Let's put it this way, right? And it says, in order to understand the rules concerning the use of the substances by one who is ill, we must present brief synopsis of the halachas regarding the treatment of the illness and injury on Shabbos. Somehow I thought that we covered it a long time ago. I'm not sure why, and that's why I was referring, when I was explaining, I referred that we learned it before. But okay, so now it's actually, we got to the point. I think it's he would explain one topic only in one book. He would not like explain two different books, like at least this topic. Okay. So again, in order to understand which creams and ointments, so meaning like for medicinal reasons, right, that we can use on Shabbos, we have to understand who can be applied to. Like is sick person, what is sick person, right? About treatment of illness and injury. Okay, so number one, the illness is life-threatening. One is required to transgress any biblical or rabbinic law to save person's life. Therefore, if person has a life-threatening injury or illness or injury, sorry, he is chole shein bo sakana, right? A patient whose life is in danger, and he requires treatment that is normally forbidden on Shabbos. One must violate Shabbos on his behalf. If time is not of essence, and there is a non-Jew available, one should instruct non-Jew to perform forbidden act. Furthermore, even if a forbidden act is not actually saving a patient, but is needed simply to alleviate his suffering, or to refresh him, or to make him feel stronger, one may violate Shabbos to perform this act. Therefore, if patient suffering from life-threatening illness requires a certain cream or ointment, it may be applied on Shabbos, even if it is not cure the patient, right? If non-Jew is available, one should instruct non-Jew to apply this ointment. If a non-Jew is not available, it may be applied by a Jew. If possible, a Jew should smear the ointment in unusual fashion, with a shinoi. For example, with the back of his hand. If this is not possible, one may smear in a normal manner. Okay, so let's stop here. All right, so altogether, there are like 5 levels of the sick people. 5 levels. So the highest level, the more severe level, of course, is a person whose life is in danger. So if a person's life whose life is in danger, we can do anything that is needed, right? And it says, we learn in our class of for medics, right? So for doctors, for nurses, right? We have one nurse practitioner who actually consulted us with all of the procedures because some of these Latin terms I cannot even pronounce, right? Needless to say, I would not know what is it. So he actually explained to us what is it and how to do it. It's very interesting, right? So we said there that according to halacha, even if you're not an expert and something is internal, right? So internal, so we have to treat it like a life-threatening. For example, somebody said to you, "I have internal internal bleeding." Can you prove it? Do you know how it looks like? I mean, does it? Can you see from outside? No, most likely there is a way to know, but that's a different story, right? So I don't know. The person says I have a heart attack. I have this heartache, and something with my lungs. I cannot breathe, or like it's hard to me to breathe. Can you see inside? No. So in this case, all of these cases internal. And even external, if you're not an expert, so we can treat it as life-threatening. Not everything is so, but internal for sure. All of this, unless it's muscle, and you everybody knows that if somebody have a sore muscle, they pull muscle, it's not life-threatening, basically. So it's going to be a different category. But if person says I'm dying, I'm getting weaker, this and that, so yeah, so we can listen to him, right? And if a person said I'm okay, and doctor said he's not okay, she's not okay, we must listen to the doctor. And right, I'm talking about Shabbos. So meaning that we can violate Shabbos for that person. And if this person says, doctor said, no, he's fine, she's fine, and this person said, no, I'm dying. So in this case, we must listen to a person. So basically, we go in stringencies, like if it's possible life risk, because our goal is to save the life. Okay. So again, from the beginning, one is required to transgress any biblical or rabbinic law to save a person's life. So that's period. That's what it is. That's our goal. Therefore, if a person has a life-threatening illness or injury, he's an chole is a sick person. Shein bo sekana, patient whose life is in danger, and he requires treatment that is normally forbidden on Shabbos. Right, one must violate the Shabbos on his behalf. So, meaning for that person, all Shabbos laws are set aside, and not only as we're going to see the procedures that need to be done to save his life, right, to address this life-threatening issue, but even secondary issues that has nothing to do with a person's life, right? So very interesting. So we'll see. Even to refresh him. Like if you're going to make him a sponge bath, like how is it like a person with a different issue? Like is it like medicine is going to help? Yes, it's going to. I mean, like in general, right? A person is going to feel a little better. That's already would be something that allowed. Right. So we violate Shabbos on his behalf. If time is not of essence. So the thing is so you need to drive somebody to emergency room. Yes, you can drive somebody to emergency room, but you cannot shut off the car. Right? Technically, you cannot close the door in the car. If you think about it, right? Right? You were allowed to get into the car and do the drive and do everything because it's for saving life. Now you transfer this person, you brought this person to emergency room. Right, and right as soon as the person got out of the car, so there is no life threat. Like if there is, it is still threat of life to life. But now the hospital personnel is going to take care of you, not you. Your job is done, so you no longer is allowed to violate Shabbos. So meaning you're not allowed to drive back. You're not allowed to close the door. Basically, you're not allowed to shut the engine. Right, so what do? You ask non-Jew basically. If you dance, you ask non-Jew to do the things for you. Okay. And usually non-Jews, so we have hospital not too far from us. So there are many Jews working there, religious and non-religious. So they know what to do, basically, right? If you tell the person, and it's somebody say, I'll go. No, you're Jewish, right? Yes, I'm Jewish. I'm not religious, so I can. No, you cannot go. Right? Let's ask somebody else, please. And you can ask a person, so he would park your car or do something, right? Okay, and keep the key until later on. No problem. Okay, so meaning for the saving of life, yes, we can. We not can, but must do everything possible on behalf. If time is not of essence, time of not of essence. Right, so meaning right, there is a life risk, but there is disease, but still 10-15 minutes would not change anything, right? So, and there is non-Jew available, they should instruct a non-Jew to perform the forbidden act, right? So meaning that you can instruct this non-Jew like straightforward without any wake language. Just tell them, ask them what needs to be done. Tell them what needs to be done. Okay. Furthermore, even it is a forbidden act. So here again, we're allowed to do anything that is needed for that person. If time is not an essence, so you can ask a non-Jew. And this structure we're going to follow like in the different halachas, different stages as well. We'll continue. Furthermore, even if forbidden act is not actually saving a patient, but is needed simply to alleviate his suffering. So meaning what? One example, to turn off the light. Right, a person suffers. He wants to sleep. She wants to rest a little. This light, it's too much. I remember light when you read the theoretical halacha about this light and you cannot sleep. Okay, so can you put a pillow on your head, or a blanket or something, or I don't know, a towel? If it's not sufficient, just sleep. What is so sensitive? But guess what? Once we stay in hotel in the Yerushalayim, and we try to be fancy schmancy, they have built in. They have a panel, with a wall panel, and you can program a Shabbos mode. Okay, what could be better? Shabbos mode. So and it's dim, it's light, everything is good. But in the main room, right, there is lights is on. So meaning it's going to turn off when we forgot to ask. So basically, many people bought this package from hotel. You pay only zillion of dollars, and they can feed you whatever good food. But we ate our own food. We finish. I mean, we want to go to sleep, and this light is on. I think it went off 11 p.m. It was for us, it was suffering. It was not summer. Was it after Shavuos? I don't remember what was it. No, it was not after. Maybe it was Purim. We went to Purim Katan. Maybe. So 11, it's too much. So meaning that what I'm trying to say, this light bothers even a not sick person. So, but does it has to anything to do with this sick person issue? No, right? But we can do that. He would feel a little better, right? And be able to relax. Yeah, you can turn on off the light or turn on whatever they need, or if they're afraid, right? So some people they're afraid, so they say, please turn on the light. We're talking about Shabbos, so we can turn on the light again, right? If you can do with the elbow, right, with some other objects, it would be better, of course. Not with your finger, with your nose. Right. 1 second. Okay. My patient, so the whole sentence. Furthermore, even if a forbidden act is not actually saving the patient, but indeed simply to alleviate his suffering, whatever suffering is. As I said, light could be big suffering. So I mean, when you say again, why I gave this example, because we suffer. Nobody could sleep. Too much light. Nobody is. It is suffering. or to refresh him, right? So meaning with a sponge bath, something, right? Or meaning in this case to warm up some water. That's what it means. And use a sponge, meaning squeeze. Whatever you need to do would be allowed. Refresh it. To make you feel stronger. One may violate the Shabbos to perform this act. So again, we should not know of these things, but we have to be prepared. So maybe the skills would be needed for somebody else. Okay, BeEzrat HaShem. No problem. So for a sick person whose life is in danger, you can do things that needed for the person's health. You can do it directly yourself. If time is not an essence, you can ask non-Jew. For example, if person is like having heart attack, and now he said, oh, I'm going to find a non-Jew, like this neighbor from this floor, from that floor, for them to call Hassan. No, you call Hatzala, because they must come as soon as possible. Or you call ambulance, whatever you call. Right? From your phone. Don't ask them to dial from that phone. Okay, so therefore, right. And plus, we can do again for this person some extra things. Therefore, if patients suffer from life-threatening illness, requires a certain cream or ointment, so that's our big topic, it may be applied on Shabbos. Right, even so, some have some burn or something, right, or some boils, all of these things. Even if it's not to cure the patient. So meaning again, if there is a patient suffering life-threatening illness, requires certain creams or ointment, it may be applied on Shabbos even if it's not to cure the patient. So meaning that again, the patient has different issue, but this would alleviate his little suffering in another place of his or her body, so we can apply this ointment. If non-Jew is available, one should instruct non-Jew to apply the ointment. So ointment usually, like in my mind, it's something like very dense, would be forbidden on a biblical level. So it's not even about smearing is of course like a different issue, but even this density would be forbidden. Right. So again, if no Jew, you can apply yourself, right? If possible. So if possible, meaning we try to minimize the desecration of Shabbos. Try to do with shinui. Shinui, as we explained, shinui concept we explained in the Shabbos kitchen. I think a lot. How to mix with shinui? We say usually how do you do mixture? You mix with a spoon. Right, so here we say no, not with a spoon, with the back of the spoon. Nobody, normal person would not mix with the back of the spoon or with a finger. So this with your finger, with the back of the spoon, with a knife, for sure, that's amazing shinoi. Right, so unusual way. So here, if you can smear with shinoi, so you usually smear is the best way to smear with fingers. So maybe here with the back of your hand, if it's possible, if it's productive. If it's not productive and you're making mess, stop it. Okay. If it's not possible, he may smear in a normal manner. So that's okay. So that's first category. Again, when life is in danger. So and here he's talking about these creams and ointment, but technically this applied to all other areas as well. Continue. Number 2. So second category. If the illness is not life-threatening, so I think in my mind, majority of the cases that we were going to deal in our life is going to be this category, not the first one. Right? I mean, possible also the first one, but I think majority of this one. If the illness is not life-threatening, if one's illness or injury is not life-threatening, but is debilitating enough to require bed rest, for example, flu, right, or is so intensely painful that the entire body is affected, for example, severe earache, right, he's in category chole she'ein bo sakana. apologize. I'm not sure why I misread that. So the previous one was Chole She'esh. Maybe I said it, I don't remember. Okay. Chole She'esh Bo Sakana. So a patient whose life is not in danger. I think I said it automatically, this one. Okay. So because Chole She'ein, last is Nun, Bo Sakana. Right? So She'ein. A patient whose life is not in danger. Okay. So the rule of Chole She'ein Bo Sakana is as follows. One is forbidden to transgress biblical prohibition on behalf of this patient. However, one is permitted to transgress rabbinic prohibition on his behalf. If possible, rabbinic prohibition should be performed in a unusual manner. There is a shinui. Some poskim maintain that as long as one performs the prohibited acts with shinui, one may violate even biblical prohibitions on behalf of this person. Chole she'ein bo sakana. In case of need, one may rely on this poskim. One may instruct a non-Jew to perform melacha, even one forbidden at biblical level, for the benefit of Chole she'ein bo sakana. Okay, so let's stop here. See, this section is much shorter. So again, as I said, I think majority of our cases is going to be fall under this category. So meaning a person required bed rest, right? Something flu. Do people die from flu? Is it life threatening? Of course, flu can be life threatening. So, but we're talking about regular flu. Person has fever. Right, so I need sleep liquids, or I don't know, something, some medicine. All right, right, some medicine, and actually the medicine parts is falls in this category as well. Right, something that I need for to cure a person. Okay, so let's see. So from the beginning, if one's illness or injury is not life-threatening, but debilitated enough to require bed rest. So all these flus, all of this, meaning even broken limbs, right? So a person cannot walk, right? Or even a broken hand, right? Sometimes people report they have such a pain from like a fractured hands, a fracture like legs. They have to be on constant medication, painkillers. Right? A person asked me if they allowed to take, because this holy tzaddik wanted to learn Torah, and he said, "Look, I take this medicine. I'm slow. I cannot read two lines." Right? I said, "Look, if you can handle this pain, maybe with half a pill. I don't know. Try if that does not work. So take the whole pill. Basically, you're not obligated to take painkillers. So if you have pain, so the doctor prescribe you the dosage or whatever they decided from their experience. But does not mean that you're obligated to drink to take them. If you can take half of it or 1/3 of it, right? You can do that. Right, but right. So the meaning of is technically, can you walk with broken hand? Yeah, you can walk. You can do many things, but sometimes it's the pain is unbelievable. Okay. So for this person, right, or intensely, right, or so intensely painful that the entire body is affected. For example, severe earache, right, and sometimes toothache. So what is a toothache? Yeah, little tooth, little cavity, little, I don't know, like a root canal makes a person very weak, right? And that's very weak. So meaning it's in the person is going to be in this category. He's in category Chole she'ein bo sakana, a patient whose life is not in danger. Okay, is not in danger. No problem. The rule is that this person whose life is not in danger is follows, right? So how do we treat? So again, we can do some things, but not everything. It is forbidden to transgress biblical prohibition on behalf of this patient. So what is biblical prohibition? We cannot make him tea, like boiled water, right? The person said, I want to wash myself with hot water. So would not allowed to do so. Okay. Cook like soup or something. Okay. So all of these things might be thought in advance. So if somebody is sick, so you can prepare more water in a water urn or like a thermos, right? So also it's going to hold the temperature for 24 hours. That there is no problem. Several cups of hot tea you can drink, no problem, right? So meaning if you know that person is getting sick or somebody is sick in the family, try to prepare before Shabbos. I mean, if it develop on Shabbos, what can you do, right? But if you knew before Shabbos started, so we have to think about like what this person might need, so to lessen the desecration of Shabbos. It is forbidden to transgress biblical prohibition, as we said, just cooking on behalf of this patient, and same with this ointment, right? We're going to see. However, one is permitted to transgress, so meaning, right? So meaning to apply what ointment may be, but smearing is a different story. So it's going to be on a biblical level. Okay. However, one is permitted to transgress biblical rabbinic prohibition on his behalf. Okay. So again. If a person's life is not in danger, so we cannot transgress biblical prohibitions, but we can transgress rabbinic prohibition, and we can ask non-Jew to transgress biblical prohibition on behalf of this person. So we can ask non-Jew to warm up tea or cook soup or warm up soup. Right? For example, we have soup, but it's cold, refrigerator. As we said yesterday in our class, right? We're not allowed to warm up liquids as Ashkenazim. Okay. Possible rabbinic. Okay. So and he also adds, if possible, so we're trying to lessen our transgressions, possible rabbinically prohibited acts. So even though he said it's allowed, if possible, do it with a shinoi. So a shinoi is not usual manner of doing things. Okay, continue. Some poskim maintain that so long as one performs a prohibited act with a shinui, right, one may violate the biblical prohibition on behalf of this person. Okay. So meaning there is some opinions of our poskim. So they say, that if person transgresses for this person in this, whose life is not in danger, something on a biblical level, but with the shinui it would be allowed. So and as we always say, look, if there is opinion, it's not just opinion of somebody, right? Shmendrik or something. That means like an opinion of very important poskim. So in case of the need, even though as he said, don't do it. So in case of the great need, if it's in a shinui, so if person does with the shinui, it's never a violation on a biblical level, just so we know. Right? In order to get the death penalty, so a person has to do melacha on the biblical level, a straightforward way. Okay. All right, so with shinui, right? So with shinui, even biblical, and we can rely on this poskim. One may instruct non-Jew to perform any melacha, even forbidden on a biblical level, by biblical law, for the benefit of this person, chaleshen bo sakana. Okay, no problem. So as we said, and now we're going to go in the third category. And third category, the ointment. No, it's not category. It's okay. So let's see what is it. So it's number 3. Let's say number 3, ointments and creams where the illness is not life-threatening. Right. So I think I said 5, but actually there are three levels. Right. There are only 3 levels. So even though there is 5 points here, but it's only 3 levels. So again, persons whose life is in danger. Second, whose life is not in danger, but some some serious condition, and the third one, a localized illness. Localized illness. Okay. So let's see. Under the certain condition, creams and ointments may be used in treatment of chole she'ein bo sakana. So meaning a patient whose life is not in danger. So this class that we just finished, right? Type. Okay. For example, if one is suffering from severe sunburn, oh, here we go, good example. He's in the category of chole she'ein bo sakana. If cream ointment would relieve his pain, the following procedure should be followed. Okay. So, if the conditions develop before Shabbos, right, one should smear the necessary cream into the bandages before Shabbos and store them in a plastic bag. He is then permitted to place the bandages on the affected area on Shabbos. This is permitted even though the cream will become smooth when the bandage is placed onto the skin. We're going to explain all of this. BeEzrat HaShem. In this way, he avoids transgressing the prohibition of smoothing. Right. However, if the medication cannot be prepared before Shabbos, this is the law. Okay. A. Preferably one should use the liquid medication or the aerosol spray so that not to transgress prohibition of soothing. Okay. However, if possible, the medication should be applied in an unusual manner. That is with the shinui. For example, by spreading the liquid. Spreading the liquid is a pinky or the back of the hand, or by the pressing button of aerosol can, right, with the thumb or pinky. Okay. The purpose of the shino is to minimize violation of rabbinic prohibition against using medicine on Shabbos. Okay, B. So let's go a little further. Using liquid medication. If the using liquid medication is not an option, the next best thing is to use the cream that is prohibited by rabbinic law only. For example, moderately thick substance. Okay. If the cream is in a jar, right, it is removable. Inevitably involves the certain amount of smoothing. Right. Therefore, one should remove the cream in unusual manner. For example, with the handle of the spoon or a fork. And then place it on affected area. The bandage may be placed over the cream, even though this will invariably smooth it out. If the medication comes in a tube, one simply squeezes it from the tube into the affected area. One may then cover the medication with a bandage. Okay, so I think let's stop here. Now let's review, then we're going to come back. Not sure if we could do it. It's, as you see, it's very, very long. Baruch Hashem. So let's now, after we describe these two main categories of the sick people, again, one is whose life is in danger, but the one whose life is in danger is a simple case. As we said before, you can do anything needed for that person. So that's that simple case, that's straightforward. Right? Of course, we said if possible, it's on biblical level, you can ask non-Jew. If non-Jew is available, try to do with a shinoi, all of these things. So, but the point is that our focus is not point. Our focus is on the second category, when the life is not in danger, and we're not allowed as a first preferred way, as we said, not allowed to transgress Melachot on a biblical level. So that's the whole discussion. The way I understand it is going to be about this level, right? Okay. So let's start, and BeEzrat Hashem should help us to understand this very good. Okay, so again, so this just to give us a background. So I always like to have background, the big picture. So if I have me personally, if I have the big picture, so I can understand the details better, right? Me personally. So the big picture is that we have Melachot of grinding, right? Grinding. What they grind? They grinded herbs, right? To make dyes, dyes like to dye the fabrics. All right, not the fabric, the threads, and then they will do the fabrics, right? And that's why our sages say so. They're not allowed to grind medicine, right? And this thing in the pestle, and that's how they used to grind. Like sometimes you go to the doctor. I went to the doctor, that dentist today, right? They have all the like drawings from long time ago, and you see like from the pharmacy. The pharmacist always like does something like grinds like herbs, and then they measure on these scales of these primitive scales, like in olden days, and then mix the herbs and give it to you, right? So meaning that's since. The way I understand that in order for this medicine be fresh or fresher, they would keep these herbs right in natural form, just dry, and in case of the need, they would grind. So meaning the freshly ground, right? Freshly ground. Same I think with us. Like if you have peppers, right? You can have a ground pepper, right? Pre-ground, or you have like pepper mill, right? And make a fresh pepper, like totally different things. Okay, so that's why our sages say that we're not allowed to take medicine. What is the connection with me and the herbs? I'm not grinding the herbs. I take a pill, right? I take a capsule. I take like syrup or something, like a cough syrup. Like what is the connection? What is the connection? But they say it is connection. And even though like I'm not going to take the pill and going to grind the pill, right, or anything, so our sages say we still continue apply this halacha since we've been doing for so many generations. So even does not apply to us, it still we apply. It is applicable. So that's the connection of the medicine and these creams. That's how we got to the creams. But creams, as we said, like beside it's being medicine, right? Beside the medicine, it's also like a problem with the smoothing, scraping. But we say scraping in order to smooth. Okay, so that's a little background. Okay, from the beginning. Under certain condition, cream and ointment may be used treatment of this second category, whose life is not in danger. For example, if one is suffering from severe sunburn, so I think it's a good example. So kid came first day to the to the bungalow colony, got sunburn. Happens all the time. So of course you have to have this sprays, whatever you have, to apply the sunscreen. It's a must, right? Don't be a hero, right? Severe sunburn, and some sunburns. I think we learned in that class for medical professionals. So like several stages. I would not remember all the stages, but some stages it's life threatening, right? So a person would develop such a fever, like dangerous situation. Okay. So, but the majority of the sunburns not so severe. So, meaning they in this category whose life is not in danger, right? If the cream or ointment would relieve his pain, so right, the following procedure should be followed. So there is like a we always buy this long time ago. We used to buy this afterburn, right? Afterburn medicine, it's not medicine. Like it is afterburn is it's not a cream. It's like a gel or something. Okay. Right. If the condition developed before Shabbos, one should smear the necessary cream into the bandages, So I mean, if you have these bandages, so meaning because the way I see this thing does not is not only in one specific place that you can put it on a band-aid or something, like you have a scratch or some boil, so it would be easy. No, it's like usually when we're talking about sunburn, it's like a larger area. So maybe I don't know, on a paper towel or something, or some handkerchief or something. So meaning like squeeze it, prepare, put it in a bag. So don't leave air in, of course, right? So it would not touch this ointment, and then apply the ointment on Shabbos. So meaning for sure you would need it. So meaning you already save yourself several steps. Right. He's permitted to place the bandages onto affected area on Shabbos. So meaning person like yes, this cream is going to get smeared or smooth. They call it like after you put the bandage, but it's going to be only indirect grama. So for sure, like a grama, like indirect, you already like one level removed. So it's not going to be violation of biblical level for sure. Okay. In this way, he avoids transgressing the prohibition of smoothing. Right? So smoothing, the way we know smoothing is smoothing like this. So, but if this is indirectly, so did it get smooth? Most likely, but it was indirectly. However, if medication cannot be prepared before Shabbos, so they forgot and or condition just developed on Shabbos, so it was a little like a reddish mark. Now it's like something like purple. Okay. So if it developed on Shabbos, cannot prepare on Shabbos, so this is the law. A. Preferably one should use the liquid medication or aerosol spray, right? So that not to translate biblical prohibition of smoothing, right? So again, our problem is the smoothing. So in this case, medication issue that does not apply, right? Because for sure the person is suffering. Right, he's in the second category. For sure, we're allowed to treat him with medication. So when people say there's a medication is not allowed on Shabbos, we're talking about the third group, the third type. We're not going to get it today, but maybe next time, BeEzrat HaShem. So, and that type is most likely. Most medication would not be allowed, but in this type, when a person's life is not in danger, but still a person is sick, medication is allowed. So now the only issue, as we said, two issues. The only issue is smoothing. However, if possible, the medication should be applied. So if it's possible to get liquid, right? Even this liquid after burn, I'm not sure. I don't know, maybe after burn, maybe. So right, I mean, I'm sure that there are many sprays. So we don't go on sun to get a suntan or something. So I don't know these things, but technically we can find out. Is it some like a aerosol in a liquid form? Okay. However, if possible, the medication should be applied with unusual manner shinoi. So meaning, again, you can squeeze on something, apply to something, and put it on this affected area. Okay. He gives a different example. For example, spreading liquid with the pinky or the back of the hand. Okay, so that's now like usually people do with these three fingers. Middle fingers, so with pinky nobody does it, or even with the thumb nobody does it, or with the back of the hand. Okay, so if possible. The purpose of shinui to minimize violation of rabbinic prohibitions against using medications of Shabbos. So sometimes we also, like in Shulchan said, if you try to do shinui, and this sick person would be scared, agitated, like why are you doing this? So sick people, Sometimes they would say stay by me, but you doctor, can I help you? Like you sleep? No, please stay by me. So because they're scared, or they want to ask you to do this and that, like turn on the light or do something. I don't know, right? So we're allowed to do that, even though it's not going to help the condition, but we're allowed to do that in order to calm them down. There is special. I forget what is this permission called, but to calm them down. So, but he said that try to do with a Shiur. So next one, B. If using liquid medication, so liquid is of course it's not right, it's not prohibited. Again, medication also not prohibited. It's not an option. The next best thing is to use cream that is prohibited by rabbinic law only. There is moderately thick substance. So meaning something that substance is going to flow, maybe not as fast as olive oil, but somewhat. Okay. If the cream is in a jar, right, in a jar, its removal inevitably involves certain amount of smoothing. So meaning what amount of smoothing, like the rest of the cream there. So as we said, it does not apply to food. Just a reminder. So we said you can get the ice cream with the ice cream scoop. Is it going to smooth inside? 100%. But does not apply to food, but it applies to creams. So he said what? Therefore, one should remove the cream in the usual manner. So usually you will remove with a finger, for example, right? With the handle of the spoon. So since you already removed with the handle of the spoon, for sure it's Shiur. Try to apply it to affected area right away. So meaning don't transfer to your finger. Handle of the spoon or the fork, and place it on affected area. Again, why? Because this is going to be removal with the Shiur and applying with the Shiur. The bandage may be placed over the cream. So now we don't want to smooth, we want to smooth like indirectly. So if you put the bandage on top and you press it, for sure it's going to smooth under that. This is what. A bandage may be then placed on the cream, even though this will invariably smooth it out. Okay. If medication comes in a tube, one is simply squeeze it from the tube into affected area. So a tube, as we understand, it's better. So you really need the intermediate level. And right, and we said there is no problem with food. There is also the food, needless to say, it's no problem. So you can squeeze ketchup. Right? Is it going to get smooth? Compared to what was in the bottle, yes, but it is well, same as here. Tube is good, so it's from tube directly to the affected area. One may then cover the medication with a bandage and press it, or let that person press it, and and it's going to be indirectly. Continue. If simply placing a cream on the skin is not good enough, and one actually obligated to smear it. So, and that's we had this experience with some medication. So you have to smear it, and it takes time to smear it. And actually, on the jar it says smear it until it's completely absorbed into the skin. Somebody, I remember somebody said maybe it's going to get absorbed. No, I said, look, these people who wrote the instruction on the jar, that's what they meant. So it takes time, and it did take time. I know 2 minutes, 1 minute, I don't know, right? But it's possible to smear the whole quantity for sure. Okay. So meaning that just pressing on top is not going to work. So you need the smear into the skin. So, okay. If simply placing cream on the skin is not good enough. Right, so meaning that, but with the sunburn, I think that's good enough. Okay, and one is obligated to actually smear it. Obligated meaning that's instructions. One may smear it in unusual manner with the back of the hand. This is allowed because the cream is forbidden by rabbinic law only. Okay, and one is permitted to perform a rabbinically prohibited act in unusual manner. In order to benefit chole she'ein po sakana. So we said now if needs to be smeared, if you don't have any other option, so you can smear, but in unusual manner, right, with the back of the hand. So again, something that is forbidden on the rabbinical level is allowed to be done, right, even in a straightforward fashion. But first, we try always to minimize this thing, to minimize the desecration of Shabbos, right. So next one, and the last one, and we're not going to go further. I think we stop here. So C. If one is obliged to use cream that is forbidden on biblical law, by biblical soul, right, there is very thick substance, the following procedure should be followed. One removes from cream from the jar in a manner that's stated above, right, and places it on the skin. If the medication comes in a tube, one squeeze it out and let it simply fall into the skin, right. Once this cream is on the skin, one may not smear it, for sure, for this violation of the biblical prohibition. However, the bandage may be placed on affected area, even though it will invariably smooth out the cream. If the cream must be smeared, one should instruct non-Jew to smear it. If one does not have access to a non-Jew, one may smear it cream in unusual manner, for example, with the back of his hand. In this situation, we rely upon those authorities who permit the person to perform the biblically forbidden act in unusual manner, in order to benefit Chole she'ein bo sakana. Okay, so let's go up to here. So now we go to the case C. Is the most severe case. Again, we're talking about a person whose life is not in danger, and as we said, we're allowed to do everything that is allowed on a rabbinical level, but not on a biblical level. And on the biblical level, so only after the fact. So, and plus we try to do through the non-Jew. So if something is forbidden on a biblical level, you can ask non-Jew in a straightforward fashion. Okay. So from the beginning. If one is obliged to use a cream that is forbidden by biblical law, so meaning these creams like very strong, very concentrated cream, usually that's like a strong with medication, right? Right. There's a very thick substance. The following procedure should be followed. So two issues, right? One issue is that if you're going to take this cream out from the jar, you're going to smooth the cream inside, the rest of the cream inside, and then the person is going to smear. So two issues. So we try to avoid both of them, right? At least one of them. So first we try to avoid both of them, then at least one of them, then we seek different solutions. Okay, so one remove the cream from the jar in the manner stated above. So meaning manner stated above with not with the finger as usual, right? But with the back of the spoon or something, back of the fork, with a knife, something. Okay. Okay, so far so good. Okay, and place it on the skin. So since it is already on a spoon, most likely, the way I understand, most likely it's not going to fall off from this spoon, right? So we have to put it on the affected area. Okay. If the medication comes with a tube, so meaning if still forbidden on a biblical level, but it's in a tube. Okay, no problem, right? So a person squeeze it and let it simply fall onto the skin. So if it's possible. So sometimes again from the sick person would think that we may making fun of them. You understand? So child especially. I mean the section about children we're going to leave for the next time, or some elderly person. and they would not take these shinui procedures very well, and they would be agitated. So in this case, like for the betterment of that person, you can do the straightforward way. But if not, if a person is okay, so we must do all of these the things with shinui. Okay. So if you squeeze, let it fall with the skin. So person is in pain, and you aim in like with the tube. So you have to imagine like a situation. So again, if it's going to too much for this sick person, don't do it. Right. And one woman said that her husband, he is very sensitive, and he starts crying and yelling at her like that she's not sensitive, like about this all of these things. Okay, so I said, look, in this case, like for a shalom bias, like and since like for him it's going to be big relief, so you can do like straightforward way, since there is like some poskim that allow it to do it anyway. Okay. So right, fallen skin. Once the cream is on the skin, you may not smear it. So right, because there is why you may not smear, because there is other ways to do that, right? So right, because we let a biblical prohibition, and right. However, the bandage may be placed on affected area, right? Even though it is inevitably smooth the cream, and if needed, maybe. Right, put more bandages on top, right, and then it's going to be squeezed even better. So, right, also possible. If the cream if the cream must be smeared, one should instruct non-Jew to smear it. So that's as we said in straightforward language, right? If one does not have access to a non-Jew, one may smear the cream in unusual manner. So unless you have a non-Jew who's very familiar with Jews and who can help us, there's no problem. But I'm not, me personally, I would not go to our neighbors and ask them about anything. So even though I think one time in our life we forget to turn off light in a refrigerator. So I said, look, HaShem wanted the situation to be like that. So we're not allowed to close the door of the refrigerator. Baruch Hashem, we learned people, we know what to do. We bought the blankets, right? We cover the opening, so meaning to like insulation, right? And we went by with the food whatever we had. Okay. All right. Right, that's it. So technically, were we allowed to ask non-Jew to do that? Yes. So to remove the food, close the fridge, open the door. We don't need that. But technically, again, there is, if there is you have this friendly non-Jew, no problem. For example, so if a non-Jew is available, ask him. If not, you can smear yourself. If smearing is absolutely necessary, as we said, if it says on a jar in the prescription of the doctor, okay. With the back of his hand. Right, or I guess with the spoon, the back of the spoon as well, right? With anything else, not because usually person smears with the fingers. In this situation, we rely upon the authorities who permit the person to perform biblically forbidden act in unusual manner in order to benefit this sick person whose life not in danger. So I think we stop here.